Chapter 19 by John Geyman is titled "The United States of America Should Adopt Universal Health Care." Geyman begins by talking in his introduction about how the 2008 national elections led to an intense debate over how healthcare should be financed and delivered in the United States, leading up to the Patient Protection and Affordable Care Act of 2010. However, he believes the resulting legislation is going to fall far short of its original goals, namely to provide universal access to affordable care of good quality for everyone, as he describes in his book. These are some of the basic issues, he says. Should health care be a human right or a privilege? Second, should we have a system of universal access based on medical need, or the present one based on ability to pay? Third, who is the healthcare system for? Is it for patients and their families or corporate stakeholders in the marketplace? And fourth, should healthcare be a public service or a commodity for sale on an open market? Now, he points out that in order to make a case for universal healthcare in the United States, we need to consider four interrelated subjects, and these are the four main headings that we're going to look at below. So first, historical and international perspectives. He points out that the passage of Medicare in 1965 was really a big advance in assuring a defined set of medical benefits for all Americans aged 65 and older. And then Medicaid in the very same year provided an important new safety net for low-income Americans. However, these are exceptions rather than the rule. The United States still has a lot of privatized health care. The tables he lists on Table 19.1 describes 15 advanced countries that has universal coverage for their whole populations between 1960 and 80, and Table 19.2 ends up talking about how other countries have some higher performing healthcare systems at much less cost while still giving universal access. Okay, so representatives of the U.S. have been involved internationally in a working group of 4 countries in London in the late 90s known as the Tavistock Group. That particular group drafted several ethical principles that they thought should underpin any country's healthcare system. I'm not going to read all of them, but I just wanted to point out that there are 6 or 7 that he brings up. Now, what's a lesson for the last 50 years? He says, we can never get to universal healthcare by incremental changes of our multi-payer private-public financing system. We need to rather do it in some sort of a big swoop towards a single-payer public financing system. He thinks that's the most effective approach to meet the goal of universal healthcare. Okay, the second main section of this chapter is on the current untenable healthcare landscape. Here's what he says. The present healthcare delivery system in the United States serves business interests much more than patients. Indeed, he says, the system is dysfunctional, poorly coordinated, and inaccessible to a growing part of the population, along with its other vices. Here are some of the markers of our failing healthcare system, as described in his book. And I'm not going to go through all of them, but he runs through several different markers of the troubles that our current United States healthcare system has. And then he summarizes, in short, we're in the midst of a healthcare meltdown, with no solution on the short-term horizon. And then he gives reference to a figure showing the extent of how the healthcare costs in this country, the United States, since 1970 might compare to other advanced countries around the world. And here's that particular chart showing the United States costs going up more quickly than these other select countries. Okay, so what is the case in favor of universal health care? Here's what he says. Given our failures over the last many decades in trying to gain universal health care through multi-payer financing, it's now clear that the only way to achieve that goal of universal health care is through a single-payer public financing or an improved Medicare for All program. One of the pins of this is his premise that healthcare and healing should not be commodities for sale on a market where the business ethic prevails of maximizing profits and avoiding expensive risks. Another one of his points is that when we have an accident or when we develop chest pain in the middle of the night, we should be able to expect accessible, affordable, and competent care regardless of our age, employment status, class, income, or net worth. And he uses the idea of a crisis. He says, we are in the midst of a battle for the soul of medicine and healthcare between the market ethic and a professional service ethic. He quotes from Edmund Pellegrino, talking about a moral challenge to the medical profession compared to 150 years ago, brought by growing incursion of market values. He also quotes Dr. Marcia Angell, former editor of the New England Journal of Medicine, who had talked about some ethical problems for doctors, physicians, working under these circumstances. These physicians, she claims, have divided loyalties, on the one hand to their patients, but on the other hand to their employers. Now, they are kind of like double agents in this respect. It's hard for them to do their job well towards one group of people because they're serving another. Here's a quote from Angell. To control costs effectively, Angell says, will, in my view, require a coherent national healthcare system with a global cap and single payer. Only in this way can we have an affordable healthcare system that does not require doctors to be double agents. Now, you might think the market could handle this, right? So our author's article says, we have seen a continued drumbeat over the last 40 years promoting the magic of competition and markets in healthcare as the answer to our system problems of access, cost, and quality. And then after summarizing a couple of voices here, he says, the problem with this market theory is that it does not work. Now, he even says the supposed reforms of the Obamacare law claimed by its supporters to help contain costs in the coming years are also likely to be ineffective. Instead, these reforms, or so-called reforms, are more corporate than patient-friendly. Now, he talks again about his book, or one of his books, and he mentions how the insurance industry in this country plays a major role in perpetuating uncontrolled health care inflation. What are the social bases for universal health care? Well, one of the important things that he raises in this section is the idea that a universal health care program for our entire population of citizens, he has in mind, of more than 300 million Americans, would bring our people together, regardless of their age, or their income, or their occupation, or their class. The way he puts it is that healthcare is a classic example of all of us being in the same boat. We're all born, get sick from one time to another, and die at the end of the road. So we all need assurance that healthcare will be available and affordable when we need it, and will not bankrupt us. But markets can never provide that security. Canada does it better than we do, he thinks. But what's the political basis for this? Interestingly, he doesn't think this is just a matter of enforcing something on a minority of people, or a majority of people who don't want it. He says national surveys over the past 70 years have consistently shown strong public support for a system of national health insurance. If we had a real democracy, he says, kind of flamboyantly, we would have had universal health care by now. Instead, powerful corporate stakeholders in the very profitable medical industrial complex have been able to perpetuate the market-based system through many election cycles, despite the increasingly adverse impacts of this system on ordinary Americans. And he says, if we can cut through the smoke and mirrors of the right and its stance on healthcare to widely accepted principles of conservatives, we can find a mountain of potential support among conservatives for universal health care. In particular, he says conservatives in every other industrialized country, here he's echoing Dr. Donald Light, conservatives in every other industrialized country have supported universal access to necessary health care. Why? Well, on the basis of 4 conservative moral principles. First, anti-free riding. Second, personal integrity. Third, equal opportunity. And fourth, just sharing. And he quotes Donald Light to the tune of several possible guidelines for conservatives to stay true to these 4 big principles. Okay, I won't go through all of them, but there they are. So, universal health care. How is this a real alternative? The way he puts it, every citizen, regardless of age, income, or health status, will have a Medicare card assuring access to physicians, other licensed providers, and hospitals of their choice for all necessary care from birth to death. In this way, all Americans will be in one large risk group. so that the risks of accidents and illness can be shared broadly. The universal health care, he imagines, can be financed through a progressive tax system that will cost individuals, families, and employers no more and probably less than they are paying now. And he imagines traditional publicly financed and administered Medicare gives us a good model upon which to build universal health care. Table 19.3 summarizes some alternative futures for the United States based on two different sorts of financing systems and sketches what he takes to be the likely pros and cons of the single-payer system he imagines versus the multi-payer system that we currently have. So, in conclusion, after summarizing his article, he says, we must also remember that whatever healthcare system evolves in response to future reform attempts will be an ethical statement about what kind of people we are in what kind of country.